What if your body was sending warning signs, but they were so quiet you barely noticed? Pancreatic cancer is one of the most dangerous cancers, not because it's aggressive alone, but because it hides. Today, we're breaking the silence around pancreatic cancer, what it is, how it starts, the symptoms people miss, and most importantly, where real hope exists right now. Welcome back to Balanced Motion Health, the channel where we turn complex medical topics into clear, practical knowledge you can actually use. Pancreatic cancer affects tens of thousands of people every year worldwide, and the survival rates are still lower than many other cancers. Not because it's untreatable, but because it's often found too late. In this video, we'll walk step by step through pancreatic cancer in plain language. No fear tactics, no medical overload, just facts, clarity, and empowerment, so you can protect your health and support others with confidence. Section 1. What is pancreatic cancer? Let's start with the basics. The pancreas is a small but powerful organ located deep in your abdomen, behind the stomach. It has two major jobs: producing digestive enzymes to help break down food, regulating blood sugar by releasing hormones like insulin. Pancreatic cancer begins when abnormal cells grow uncontrollably in this organ. About 90% of cases are called pancreatic ductal adenocarcinoma, which starts in the ducts that carry digestive juices. Because the pancreas sits deep inside the body, tumors can grow for a long time without causing obvious symptoms. That's what makes this cancer so difficult and so dangerous. Transition. Now that you know what pancreatic cancer is, let's talk about why it's so hard to catch early. Section 2. Why pancreatic cancer is often diagnosed late. Here's the uncomfortable truth. Early pancreatic cancer usually doesn't hurt. There's no routine screening test like a mammogram or colonoscopy for the general population. And early symptoms are vague, things many people brush off as stress, diet issues, or aging. By the time symptoms become clear, the cancer may have already spread to nearby organs or blood vessels, limiting treatment options. But this doesn't mean early detection is impossible. It means awareness matters, and knowing the warning signs can literally save lives. Transition. So what are those warning signs? Let's break them down clearly. Section 3. Early and late symptoms you should never ignore. Early symptoms often overlooked: unexplained fatigue, loss of appetite, mild upper abdominal discomfort, sudden changes in blood sugar or new-onset diabetes in adults, unintentional weight loss. These symptoms are easy to dismiss, but when several appear together, especially without explanation, they deserve attention. More advanced symptoms: jaundice, yellowing of the skin or eyes, dark urine and pale stools, persistent abdominal or back pain, nausea and vomiting, severe weight loss. Jaundice is often the first symptom that sends people to the doctor because it's visible. Unfortunately, by this point, the cancer is often more advanced. Important truth: symptoms don't mean cancer, but ignoring symptoms can delay diagnosis. Transition. So who is most at risk? Let's talk honestly about the factors that increase risk. Section 4. Risk factors for pancreatic cancer. Pancreatic cancer doesn't have one single cause, but several factors increase risk. Age. Most cases occur after age 60. Smoking, one of the strongest risk factors. Chronic pancreatitis. Type 2 diabetes, especially new onset in older adults. Obesity and poor diet. Family history and genetics. About 10% of pancreatic cancers are linked to inherited genetic mutations. If multiple family members have had pancreatic, breast, or ovarian cancer, genetic counseling may be important. Hard truth: you can live a healthy lifestyle and still develop pancreatic cancer, but lifestyle choices do influence risk. Transition. Now, let's shift from risk to reality. How pancreatic cancer is actually diagnosed. Section 5. How pancreatic cancer is diagnosed. Diagnosis usually involves several steps. Blood tests including tumor markers like CA19-9, imaging scans such as CT, MRI, or endoscopic ultrasound, biopsy to confirm cancer cells. No single test is perfect. Doctors often combine results to make an accurate diagnosis. Because the pancreas is difficult to access, diagnosis can take time, and second opinions are sometimes necessary. Key message: if symptoms persist and tests are unclear, keep advocating for yourself. Transition. Once diagnosed, the big question becomes, what can be done? Section 6. Treatment options. What actually works? Treatment depends on the stage of cancer, location of the tumor, and overall health. 1. Surgery. If the cancer is caught early and hasn't spread, surgery offers the best chance for long-term survival. The most common operation is the Whipple procedure, a complex but potentially life-saving surgery. 2. Chemotherapy. Used before surgery to shrink tumors or after surgery to kill remaining cancer cells. Sometimes used alone if surgery isn't possible. 3. Radiation therapy. Often combined with chemotherapy to target specific tumor areas. 4. Targeted therapy and immunotherapy. Still limited for pancreatic cancer, but rapidly evolving. Some patients with specific genetic mutations respond well. Truth without sugarcoating. Pancreatic cancer treatment is tough, but it's improving. Transition, but treatment is only part of the story. Let's talk about quality of life. Section 7. Living with pancreatic cancer. A pancreatic cancer diagnosis affects more than the body. It impacts mental health, family, finances, and identity. Common challenges include pain management, digestive problems, fatigue, emotional distress. Supportive care, also called palliative care, should start early. It doesn't mean giving up, it means living better, longer. Nutrition support, enzyme replacement, counseling, and pain control can dramatically improve daily life. Powerful truth: survival isn't just about years, it's about quality. Transition. Now let's address the question everyone is afraid to ask. Section 8. Survival rates and real hope. Pancreatic cancer survival rates are lower than many cancers, but statistics are not destiny. Early stage detection dramatically improves outcomes. New drug combinations are extending life. Clinical trials are opening new doors. Personalized medicine is changing the landscape. Every year, more people are living longer than expected. Hope doesn't mean false promises. Hope means progress, and progress is real. Transition. So what can you do right now? Section 9. How to protect your health and help others. Here's what matters most. Don't ignore persistent symptoms. Quit smoking if you smoke. Maintain a healthy weight. Manage diabetes carefully. Know your family history. Encourage loved ones to seek care early. Awareness saves lives. Conversations matter. Education changes outcomes. If this video helped you understand pancreatic cancer even a little better, share it. You never know who needs this information right now. Subscribe to Balanced Motion Health for clear, honest, and empowering health content every week. Like this video to help it reach more people. And comment below, have you or someone you love been affected by pancreatic cancer? Together, knowledge becomes power, and power creates hope. Thank you for watching. Stay informed, stay strong, stay in motion.